following presentation is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking with your doctor. Hi, welcome to Be Well. My name is Danielle Hoosevelt, registered dietitian and board certified health coach. And I am joined today by Stephen Hassis. He is a registered nurse here at Crossover. Hi, Stephen. How are you?
Hey, Danielle. I'm great. Thanks for having me.
Yeah, well, thank you so much for being here. We're going to talk about a very important subject today. We're going to be talking about substances and their effect on sleep. In particular, we're going to be talking about caffeine, nicotine, alcohol, and we're going to touch on marijuana. We're also going to touch on over-the-counter sleep aids. And so I'm super interested to dive into this with you because I think a lot of folks don't really understand the role that some of these substances can play on sleep. And they might think they're doing one thing when in fact, they're affecting sleep in a different way. So I'm super excited to have you here to talk about this.
Yeah, thanks for having me. I'm excited to get on this as well.
Awesome. So I want to start with an old adage that I've heard, that no one dies from not sleeping well. Can you tell me your thoughts on that?
Yeah, so I think it's actually the quite exact opposite. I think, especially studies show where they've done on mice and whatnot, when you completely take away that aspect of like the sleep wake cycle, I mean, they literally die. So I think it's in the exact opposite, sleep. And even, as more research is coming out, the lack of it is shown to lead to an early death.
Yeah, and I think, right, I think that so often people sacrifice sleep for all of the other things in their life because they feel like, oh, well, I think the other adage we hear is, oh, I'll sleep when I'm dead. But I think is what you're saying is, if you're not sleeping, that actually might come sooner than you want it to, right? It can have that impact on life expectancy.
Exactly.
Mm-hmm. Yeah. So we know sleep is important. We need it, and we need enough quantity and quality. Let's talk a little bit about how some of the substances that can be fairly common in our life can have an effect on either that quality or quantity of sleep. So let's start with caffeine. So tell me a little bit about the effect of caffeine on sleep.
Yeah. So, caffeine, it's a stimulant. It gets us going. Specifically, it upregulates adenosine in the brain, and that really is to keep you awake, keep us stimulated. It's shown, that it improves like our performance, but unfortunately that comes with a price. So specifically, on sleep, caffeine can remain in the bloodstream for up to 10 hours. Some people it's shorter, some people it's longer, and then that can then interrupt and interfere with our sleep wake cycle. So
right.
Increasing our time to fall asleep, as well as it will prevent the brain from being able to enter those deeper stages of sleep, which are responsible for really that restful sleep that our body really needs.
Yeah, so there's a couple key things that you brought up here. One is that there are some benefits to caffeine, but if it's misplaced in the day, or there's maybe reliance on too much of it, that's where you start to pay the price, in that it may prevent you from going to sleep. But the thing I think that people don't understand was the second point that you made, is that even if you can get to sleep okay, it might be preventing you from getting into the depths of sleep that lead to more of that like restorative sleep that we need. And so I've heard people who will drink coffee late in the afternoon or sometimes like after dinner. They're like, I have no problem getting to sleep, but maybe it might be affecting the depth that you can go.
Exactly.
Mm-hmm. Yeah.
Yeah. And I mean, like you said, yeah, those entering those deep stages, I mean, caffeine at the end of the day, it is a drug, it's the number one drug used across the globe. And it still stays in the body. So, I mean, it still is doing, metabolic things to us, whether or not we want it to, well after we consume it.
Right.
Like I said, 10 hours. And if you're thinking about, you know what I mean, like that afternoon coffee or whatever, you have to really think about how it's going to affect you and how it's going to be able to impact your sleep then later.
Yeah, you have to think of the long term, right? Not just like, oh, I'm going to get this very short term benefit. You also have to think about any potential long term consequences.
Exactly.
Mm-hmm.
And the impact on the body. And
Right.
I mean, I don't know about you, but I've been there. I've reached for that 3 o'clock afternoon, pick me up, and I'm like, woohoo! And I'm like, all right, cool, good to go. And then later on, I don't know. It's not always the easiest thing to then fall asleep. And then even I feel like there's been times where, I have that afternoon cup of Joe, and then I feel like it's not necessarily like I had difficulties falling asleep, but I don't necessarily feel as refreshed the next day.
Yep.
And then
same.
I feel like, then that almost causes, like a vicious cycle. Then you're reaching for more Joe the next day.
Yep.
And then really, you get that feeling you're burning, the candle on both ends.
100% have had the same thing happen. If I'm drinking caffeine too late in the day, I do notice it. I have a really hard time falling asleep, which means then I get less quantity of sleep. And I do feel like even when I do get to sleep, it's not that great. And yes, that vicious cycle. Yeah. So knowing it's got a long lifespan in our bodies, what do you suggest in terms of like, how do you consume coffee so that you're getting some of the benefits, but it's not wreaking havoc on your sleep?
Yeah, you mentioned it earlier, and I feel like really, hit the nail on the head. And that's really, with caffeine, it's really about timing. I've read, I don't know exactly who said it. It was like a dietitian or some neurologic physician, something like that. And I remember like, there being hint to like basically this optimal caffeine window. And that optimal caffeine window is like, if you are, up during the regular working hours and you work a 9 to 5 job, it's really from 9 a.m. till 11 a.m. That way it, gets in your system, gets going, but then is out of your system in time for you then to, when it comes time to it, get some restful sleep. Mm-hmm. And if if you are requiring more, caffeine to get through your day, I've been there. Like, I understand sometimes you just need a little bit more to get through it. And I mean, ideally, I know if you go to most websites, they're going to say like 3 o'clock, 4 o'clock. I even think that's too late. I really think that, 1 p.m. is really would be like a cutoff to be able to fall asleep and get some good sleep, if you're trying to go to bed around like 11 or so.
Yeah, that makes a whole lot of sense. So that 9 to 11 a.m. window, if, as you said, you're working kind of the standard, or you're up in the morning and that's your work day. Yeah, and I've also heard that that's aligned with our body's sort of natural ramp up in cortisol, which is helping us sort of get ready for our day and do what needs to be done. And caffeine in that time can help that sort of natural process. And then cutting it off, around 1, it's probably prudent so that it's not affecting that, either getting to sleep or staying asleep.
Yeah, you mentioned that, and with the cortisol, and there's a lot of new research with sleep as well as like other supplements. I forget the exact term. It's going to bug me, but it's basically like the timing of when we do things, and like essentially when we fight our biological rhythm, it's upsetting it, and it's things that can lead to, issues down the line.
Right, right. Yeah, you kind of want those things to be like symbiotic, or you want them to be in line with one another. So it's helping the natural process, not fighting against it.
Right.
Okay, so caffeine earlier in the day, cutting it off by one. Let's move on to alcohol. This is another one that is fairly common. And while it can have some benefits, there may be some detriments to our sleep. So tell me a little bit about alcohol and sleep.
Yeah, I mean, alcohol is a sedative. Therefore, it winds us down and depresses the nervous system. And I can see, naturally how some would think that it would help them fall asleep. Because, I know there's the old wives' tale out there, alcohol is a great nightcap, and that's because it does make us drowsy.
Right.
But that's not necessarily helpful.
Nope. And I think probably most of the people listening have probably experienced this, where you have, you've had a cocktail at night, or you've had some wine and you're able to get to sleep, but you're wide awake at 2 a.m. and find it very difficult to fall back asleep. So why does that happen? What is it about alcohol that sort of causes that, where like you can get to sleep, but the quality of sleep suffers?
Yeah, so, once it's digested, once it's in the brain and broken down by the liver, alcohol goes to the brain and it inhibits the brain from entering the REM stage of sleep, which is that period where it's, rapid eye movement. It's associated with creating and forming memories, and it's also the stage in which we dream. So it directly prevents that. It's funny, you're talking about like this, like 2 o'clock, I wake up all of a sudden and I'm wide awake. If you were to look at like the graphs of REM sleep as well as like alertness, they basically almost look very similar. And so it's funny that, I feel like the brain's trying to get to REM, but then the alcohol is inhibiting it. So what's the next closest thing? And that's being awake.
Yeah, that's super interesting. So the alcohol is actually acting as a barrier to us getting to REM, which is is where we're dreaming. And so then so now we're awake. What else does alcohol do, or how else can alcohol affect sleep or sleep quality?
Yeah, so I mean, just from the inhibiting of REM, and with research that looks at like starving the body of REM sleep, essentially you're starving yourself and your body and your brain really from getting that restful sleep that it really needs. And then, the next day, it's part of the element of a hangover and why we feel so lousy the next day when we drink too much. So, I mean, sleep is definitely a big part of that. As well as if you already have issues with sleep or feel that you're finding, more and more issues as you age with sleep, can really exacerbate those sleep issues.
And I've heard that there's some effect that alcohol can have, especially for those who, like you said, already have sleep issues, but in particular sleep apnea. Is there a link between alcohol and like worsening of sleep apnea, or is there a connection there?
Oh, definitely. Yeah. So, I mean, so alcohol essentially it relaxes the muscles in the back of the throat. Therefore, the airway is just easily more able to collapse on itself. And then, it's kind of also like a combo effect. So while it relaxes the muscles and allows the airway to collapse more, your brain also is like numbed to its sensation of that low oxygen levels. And then because of that, your body doesn't wake up when it would normally detect those low oxygen levels. So it's like, a compounding effect, which basically makes those like apneic periods more frequent and longer.
Okay. So for those of us who don't normally have sleep issues, if we're drinking alcohol in the evening, it's going to inhibit our REM sleep, which is pretty important. But for those who already have sleep issues, like maybe insomnia or sleep apnea, it is going to compound and make those situations even worse.
Exactly. And that's why if you know you have these issues, it's best to, limit your consumption like prior to 3 hours before bedtime. But as well, if you find that you're drinking, you're still having these issues, you really should try and avoid it.
Right. Which I know is something people don't necessarily love to hear, is that the idea of cutting it out. But I know in coaching, we say, like, if you think something might be affecting your sleep, experiment with it, cut it out for a certain period of time and really pay attention to what effect it's having. And you might be very surprised by what you find out.
Exactly.
When you take a little break. Yeah. Okay. So we've gone through alcohol and caffeine, and I can also see how those two might be connected. If you're drinking alcohol at night and you're not getting a good night's sleep, then you are probably relying on caffeine more during the day. And so now you could be doubling up on sleep disruptors. You can see how those two could be connected. So let's switch gears and move towards nicotine. This is another substance that can have an effect on sleep. So can you tell me a little bit about nicotine and the effect on sleep?
Yeah. So, I mean, I feel like we all grew up with Dare and whatnot as kids. Nicotine, it's the main component of tobacco-based products, which include, cigarettes, e-cigarettes, all, etc. A lot of scientists out there believe that it's, only second to heroin in terms of its like addictive nature. So I can see where people, can't put the butt down. But, specifically looking at it and its effect on sleep, it is hands down the worst substance that you could use out there for sleep. And it on average you lose a full hour of sleep per night.
Wow. And so is that it? So with nicotine use, is that time based? Like with caffeine, we talked about, okay, so it's got this long lifespan. And is that similar with nicotine? Meaning, does any nicotine in your system cause that? Or is it, the consumption of nicotine closer to bedtime causes that? Is there any research out on that?
Yeah, I mean, so the research that I specifically looked at, it was in the hours leading up to bedtime. And that's where, that loss of an hour really comes from. I'd be interesting to see further, like in terms of the timing aspect of nicotine and like how that impacts sleep. But definitely it 100% should be avoided up to the hours leading up to the hours of bedtime.
Got it. Okay. So for those who might be trying to quit tobacco or so that might be something to consider if you're a tobacco user in any of its various forms. Thinking about maybe targeting some of those nighttime usages first so that you're reducing the impact on your sleep as you're sort of working your way towards quitting.
For sure. Yeah.
Yeah. Okay. Um, so now we're going to switch gears again, and let's talk a little bit about cannabinoids, in particular THC or marijuana. This, to me, I think is one of the most interesting discussions about substances and sleep. And I think that this, like alcohol, people often utilize it to help go to sleep. But I think you're going to share with us some of the maybe unknown effects of cannabinoids on sleep, or things people may not realize. So tell me a little bit about that.
Yeah. So, I mean, so first I'm going to start with, obviously the most popular component or most popular cannabinoid, THC. It's everybody in the, I feel like most people have heard about it. It's the cannabinoid in marijuana that's responsible for the classic, euphoric, high feeling. And I feel like it has grown as a sleep aid from that euphoric state. There's like a belief that, from that euphoric state, everybody's chill, they're calm, that can just lead into a nice, easygoing sleep period.
Sure.
And I mean, that does happen to some point. And so I feel like that's where, it really grew on. But I feel like, over time, so far, what we've learned is it's a lot like alcohol. So, you start using it, it might help you for like, a 1 off, 2 off. As time goes on, your body builds up a tolerance. And then once that tolerance is built up, then it has deleterious effects really on like long-term sleep quality, as well as the overall quality of the sleep experience. So like much like alcohol does, THC, when it's in the brain, inhibits it from entering the REM stage. So you're not really able to dream, form new memories, create new like learning process pathways, really not getting that full restful cycle of sleep.
Right. So yeah, so there's some truth to it, being able to get you into a state where you're maybe better able to fall asleep, but you're running into the same issue as with alcohol. It's inhibiting REM sleep. And now we've talked about that now a couple times in relation to alcohol and now THC. What is the detriment to not getting REM sleep? So I know you talked about like that's where your memories are formed. So I would imagine that's a problem. But are there other things that lack of REM can lead to?
Yeah, it's actually been shown to be a causative factor for like a host of health problems. And the first really thing that comes to mind is migraines. I feel like migraines is something that's like simple, that would be easily like overlooked, and everybody would be reaching towards like other causative things rather than the THC from marijuana. But I mean, right there, from the lack of REM sleep, and migraine, not only migraines but other headache types as well.
Yeah, that's really interesting, because you're right. I think when migraines come up, they're usually we're investigating other reasons, and maybe overlooking use of THC, or not getting into that REM sleep. Yeah, that's really
and
interesting.
It's also, I feel like not necessarily people would like disclose that as easily, or even they would think, oh well, it just has nothing to do with it, so it's not even worth me bringing it up.
Yeah, I mean, I'll be honest, that is the first time that I've heard that in relation to migraines, but now that you're saying it, it makes a lot of sense. So this is maybe a good place to say, if you are using cannabinoids, if you are using THC, do disclose that to your healthcare providers. It is something that's really important for them to know so that they can take that into account when you might be looking into different issues that you're facing health-wise. So it is important to disclose that.
For sure. That and other supplements as well.
Correct. Yep. Yes, please disclose that. If disclose that, disclose medications you're taking, over-the-counter supplements, all of those things are really important. And again, you might not necessarily be thinking, hey, this could be connected to my migraines or a condition that I'm experiencing, but it could be. So it's important to disclose that to your provider. Okay, the last one that we want to hit today are over-the-counter sleep aids, because I think those also are relied upon when people are facing sleep difficulties. So like they know they're not sleeping well and they turn towards the Nital or whatever over-the-counter supplement. So can you talk a little bit about that?
Yeah. So I mean, all of these ZZZ, etc. Sleep aids. I mean, I laugh. All of them are Benadryl. So all of them have the main main drug that it is Benadryl, and they just really it's really like a marketing ploy to exploit like a known side effect of this drug. So I mean, if any of you have taken Benadryl after like you thought you have like an allergic reaction, next thing you know you're like, oh, I pass out for the next hour or so, and it's that side effect of sedation, and that's really where what these sleep aids are using as part of their aid to help you sleep.
Mm-hmm. That's really good to know that that's essentially all the same medication. And so, okay, so it is a sedative, but so then what's the problem, right? Like if it's doing that and you're sleeping, where does the problem come in?
Yeah, so I mean, you think about it and you're like, okay, so if it makes me like drowsy and I'm able to fall asleep easier, you think that like, oh, so I'm going to take it, I'm going to be able to fall asleep easier, then I'm going to get longer duration of sleep, and therefore it's also, I feel like people then correlate that with a better like a longer duration of sleep with a better quality of sleep.
Right.
And it's not exact in actuality what that is. So not necessarily is more sleep better.
Right. Yeah, because you also need that quality. So what are these things doing that's giving you theoretically enough quantity but not enough quality?
Yeah, so I mean, so it makes you drowsy and therefore you fall asleep faster. But then once it's metabolized and it really works itself through the brain's inner workings, it inhibits your brain from entering the later, deeper stages of sleep.
Okay. So again, it's inhibiting you getting into the right stages that are going to lead to quality of sleep, even though the amount of hours are there. You maybe have slept through the night, but you also haven't because you're not getting the right stages of sleep.
Right. Mm-hmm. So you're getting like that lighter stage, you're not really hitting the deeper stage. It's not really providing you with that restful sleep that your body really craves.
Yeah. Well, and I don't know about you, but I know that when I've used those in the past for sleep, or even when I'm sick, right? Because sometimes it has some of the cold and flu medicines have that in it as well. I feel terrible the next day. I feel like I have what I call a sleep hangover. I just feel awful. So
Yeah,
it,
I mean, with that, it has that, like, as you said, hangover effect. It really can cause like next day impairment. Like I know, myself, like I've struggled with, trying to fall asleep, and I'm like, oh, well, because so and so says it on the TV, it must be something that I can take, and it
totally.
should help me fall asleep, and I'll have a better quality of sleep. And then the next day, I am just struggling
Yeah.
because like you said, that hangover, and because you're not really getting those deep stages of sleep.
Yeah. I
It's
feel
just,
so dull. Like my
yeah,
brain is definitely not functioning, which then causes me to go grab the caffeine, increasing the cycle of poor sleep.
right.
Mhm.
Yeah, I really feel like, especially with, the over-counter medications, because they're viewed in a different light than necessarily these other substances are. You know what I mean? Because the other substances, you could, quantify them or classify them as a drug, where you're like, oh, well, this is a medicine.
Mhm.
And so this is made to help me. And I feel like because of that, it gets kind of lumped into like, oh, this is fine. And then next thing you know, like it just leads to this chain reaction where you're, going around in this vicious cycle where you're using the OTCs to help get yourself to sleep, but then, pouring buckets of caffeine down your throat because you're like, oh my God, I can't wake up. And,
Right.
if you look at it, what's the causative factor there? And I feel like a lot of it's those over the counter medications.
Yeah, no, I totally understand that. And again, have experienced that when I've used some of these things in the past, or even again, having like a cold, if I'm taking a nighttime medicine that's got this in it, I wake up feeling awful the next day beyond just feeling awful from the cold. And then I'm drinking caffeine to try to sharpen my focus so I can get something done. And the cycle perpetuates. So it seems like the take home message there is maybe like think twice about using OTCs, or really proceed with caution, because it's not getting you what you think it's getting you.
Yeah, the phrase that I really like is because most of those sleep aids have, Z in it. So I'm like, when it comes to those Z's, proceed those OTCs with caution. I'm
Caution.
like, yikes.
Yeah, totally get it. I want to go back just for a second. I know we talked a little bit about THC, but there's another piece of that, so just backtracking a bit, CBD. So I would love to hear anything that you've learned or you've researched on CBD in particular. Is there anything there that's of note?
Yeah, I feel like, CBD is like the buzz
Yes.
component
Yes.
of of the cannabis plant nowadays. So CBD is like, it's the non-psychoactive cannabinoid. So, and it's like everybody's just assumes that it should have this all-knowing therapeutic effect for everything.
Oh, it's good for everything. Like,
Yes.
yes, that's how it's marketed, is that it's good for everything. Mm-hmm.
Right, for
Yeah.
sure. And I feel like, there is some research to show that it has benefit but in certain targeted areas. So, it's the research really, I feel like, is, in the infancy when it comes to a lot of the cannabinoids. And that's, due to a lot of the restrictions around us studying it.
Right.
And that makes it more difficult to, make recommendations and really know exactly what it's doing to us before, it actually hit the market. I know that it's shown some promise with anxiety and pain. And there's two drugs already out there now, Epidiolex being the most recent one for seizures, And then, the older one, Minodrol for appetite stimulation with cancer patients.
That's right. That one's been around for a while. Yeah. Yeah.
Yeah. So, I mean, I feel like, there is some therapeutic benefit with it. My thing with sleep is, the research isn't fully there, and there's lots of mixed evidence.
Yep. Yeah. And that's, I think you hit the nail on the head. There might be promise, but the research hasn't caught up yet for a variety of reasons. It hasn't, we haven't been able to really study it. So it'll be interesting to see what we learn as more and more research and quality research is done. But right now, it's still pretty mixed.
Yeah. I know I was just looking the other day and kind of reading into it. And even some of the research that just as of 2019, it came out, for that first month, it might help you out, but over the long haul, is it really useful as an effective sleep aid? We can't say with 100% certainty. And it's, it does have some negative side effects. It does interfere with certain medications. So just be wary of that. I feel like it all, the Benadryl, some people I know have reported mental sedation the next day as well as fatigue.
So. Right. Okay. So let's summarize what we learned today. Keep your caffeine in the morning.
Yeah.
Limit your alcohol at night and try to remove that from bedtime. We learned that cannabinoids, in particular THC, can wreak havoc on the quality of sleep that you're able to get. CBD is a little bit of a question mark. The research is very, very much mixed and in its infancy. And then with our over-the-counter, best to proceed with caution, because it may not do what you think it's going to do. You might get duration of sleep that you're looking for, but that quality just isn't there.
Yeah.
All right.
And I mean, we need good quality sleep.
We do. We absolutely do. And that's right. To bring it back to what you had said in the very beginning. What actually lack of sleep could ultimately cause a lot of detriment to your health, and including early death. And we don't want that for anybody. We want everybody to be getting their adequate sleep, thriving, living good, long quality lives.
Exactly.
Stephen, thank you so much. This was such amazing information, and I am so happy that you were able to join me and share that with all of our members. So thank you so much for being here today.
Oh yeah, this was definitely a huge honor and a pleasure, and thanks for having me.
Yeah, of course. And for all of you listening, if you have questions about this, where you are feeling stuck on maybe how to make some changes in these areas, please do not hesitate to reach out to a crossover provider. We can help you through this. We can figure out the strategies maybe to help, reduce or figure out these substances in your life. If you're looking to quit smoking, you can come to us and we can help. So don't hesitate to reach out. And as always, take care and be well.